Good afternoon, everybody, and welcome to our webinar. People are still joining, so we'll just wait another couple of minutes and then we'll get started. Good afternoon, everybody, and welcome to our final webinar from the Enable project, which has been looking at enabling green and blue infrastructure in complex social ecological regions. It's a multidisciplinary research project funded by BiodivERsA. And as you know, the topic of today's webinar is how green and blue spaces in cities can serve as refuges for the population, the residents of the city that are experiencing the impacts of COVID-19, but also in preparing for other disasters. So the COVID-19 pandemic has really highlighted for many people the importance of these green and blue spaces in cities and how they allow people to meet and exercise and relax, even with lockdown restrictions in many places. But it's also shown that these spaces are not accessible or available for everybody. So this webinar today will discuss these issues in the context of the Enable project's research. And we will also hear from city practitioners about their experiences during the COVID-19 pandemic. We'll start off with a series of 3 presentations, firstly on the research conducted in Enable, and then on some work we did in Enable looking at precisely the evolving role of green and blue spaces as refuges during the pandemic. And then we'll hear from New York about some of their experiences during this period. We'll stop and have a pause then for your questions, and then we'll move on to a series of short presentations from Enable researchers and practitioners about the role of green and blue infrastructure during the pandemic and how they have experienced these issues. Just a couple of practicalities before we get started. You're all attending in listen-only mode, but that doesn't mean that we don't want to hear from you. You're encouraged to add your questions at any point in the Q&A box, and we will have a pause for questions after the first 3 presentations, and then we'll take your questions again during the panel discussion at the end. Please also note that the webinar is being recorded. And so we'll get started with our first presentation from Eric Anderson for a more in-depth look at the relevance of Enable research for this topic. Eric is an associate professor in sustainability science with Stockholm Resilience Center, Stockholm University. His scholarship and active research focuses on different analyses of social, ecological, and technological systems, mostly in the form of urban landscapes and the contexts and conditions that influence people's interactions with nature. His research is both empirically based and conceptually and theory driven. He's actively engaged in international research and led and coordinated the research and joint transdisciplinary learning within Enable. So I'll hand over to you now, Eric, for your first presentation. Thank you.
Thank you, Kate. And Thank you all for taking the time to listen to you and discuss with us. The topic of today is the role of green and blue infrastructure, or the role that green and blue infrastructure has played and could play during and after the current pandemic. But then most of the studies under the Enable project were done long before we had any idea what 2020 would look like. That it would be a year dominated by COVID-19 and our attempts to keep the pandemic in check. Still, even the early results from the project speaks to the current situation and can offer some insights for what we can do to make sure that everyone has their fair share of the opportunities and benefits offered by green and blue infrastructure. The Enable project has been doing research in 6 cities, quite different in the governance, proportion of green and blue infrastructure, demographic and socio-economic structures and patterns, and so forth. And the main thrust of the project was a transdisciplinary approach to urban studies, focusing on the use and governance of green and blue infrastructure. And even before COVID-19, one of the main questions was how we can deal with change and perturbations and ideally even emerge stronger from the experience. What is then the role of green and blue infrastructure? I'm sure this is not new to you, but please bear with me for a minute. Urban ecosystems have the potential to provide humans with a number of ecosystem services and benefits, from temperature regulation and food to recreational opportunities and spiritual experiences. And this is not something that we possibly receive, something that nature is just providing us with. On the contrary, we're quite actively involved in the generation of these services and the realization of their benefits. We manage ecosystems and interact with them via different activities and uses. And this is fairly well understood and widely recognized. What is less known are the effects the larger urban system has on the flow of benefits from green and blue infrastructure to urban residents. Enable took the stance that context matters and then set out to use the role of infrastructures, the combination of green and blue infrastructure with built infrastructures of transportations, residential areas, and so forth. We also looked at institutions, the rules and regulations guiding both how we might use space and also how we can think about changing current conditions or making interventions in the urban system. And finally, of individual perceptions, how people view and understand the system they live in. And we looked at these factors for their importance and role in mediating the flow and distribution of different kinds of benefits. And one of the things we wanted to get a better understanding of was for whom green and blue infrastructure actually offer benefits of value. And this is particularly an outcome of different and sometimes potentially competing needs, of different abilities to make use of presumably available options, and differences then depending on things like ownership, your own mobility, your knowledge, your skills. And we looked at different baselines. As I said, our 6 cities are quite different in terms of just how available green and blue infrastructure is, and also what kind of functions these spaces can be used for. In the end, when all other prerequisites are met, that there is green and blue infrastructure of sufficient quality, it is located within the reach of its potential users, desired uses are allowed, then use comes down to a question of other people. Many activities, as well as the intensity of use itself, are exclusive. stifling other uses or making them less attractive, which open up in our project even before COVID questions of, can we instead support others or other people's use by adopting our own? Instead of excluding others, can we actually help more people benefit or make use of green space? And what we see now during the pandemic is that people's needs have changed. With fewer opportunities available elsewhere, activities move out into the green and blue infrastructure. We also see swift changes in the larger system, with transportation systems being repurposed, and new regulations on how public space can be used, new needs for social distancing. So what have we learned about how green and blue infrastructure might be used, and how to make sure that opportunities are fairly distributed? With that, I hand over to colleagues and collaborators who can tell you more about what has actually happened this year. And finally, just an acknowledgement of all project partners and our funders. Thank you.
Wonderful. Thanks very much, Eric, for that great overview of what Enable has been about and what it's looked into and how that's relevant for our current experiences and situations. So we're now going to move on to David Burton for a more in-depth look at these issues during COVID. David is a senior research scientist at NINA, specializing in ecosystem service valuation and urban ecosystem accounting. So over to you, David, when you're ready.
Thank you, Kate. You can hear me?
Yes, can hear you well.
Great, thank you. So I'm going to introduce the topic of green refuges, enabling cities' preparedness for future pandemics and global change. I'm going to refer to a fact sheet, which was distributed as background to the meeting. So I'm going to cover some of the highlights in that fact sheet. So the topic of today is that green and open spaces are refuges from everyday stress, and especially in this case, in times of crisis. And at least in my practice and research in Oslo, I don't think we thought very actively about the role of green spaces as refuges, and we didn't use very much the language of crisis or disaster preparedness, but that has definitely become some of the keywords that have arisen during this year. We would mostly like to talk about green spaces in the context of all the positive upside benefits that they deliver in good times. But in this case, we're also raising this keyword of disaster preparedness, and then the word refuge and the function as a refuge comes up. And we want to see this in the context also of global change and climate change, where green spaces are becoming more and more important regarding handling extreme weather events, both runoff, flooding, and extreme heat. We know from before, and we're all familiar with and experience every day, hopefully, that these spaces are important for exercise and to meet other people. And in the times of COVID, especially, we've seen that they are extra important for all these aspects, but also to relieve mental stress and also lack of physical exercise due to reduced mobility due to the lockdowns. So this is some Google mobility report for the first months of this year. And what we can say, at least at the global scale, is that the pandemic, through these mobility figures, led to a shutdown of our economies. And if you look at the figures, broadly speaking, also a shutdown of our green spaces. Although we'll see with the city cases in this project that the truth on the ground is much more varied, and that parks and green spaces generally have played a very important role, even when in some places mobility has been so restricted that total use has dropped. As we see in these statistics, the situation in many cities where there were not so strict lockdowns, local parks and green spaces have received increased use, and we'll see several examples of that. As Eric was saying, COVID-19 has highlighted things that we already knew about social inequities of access, but they've brought them to the fore. We've seen that those that have been most exposed to risk from COVID-19 may also be the same populations in many cases that are have disadvantaged access or availability to green space. And also that mobility restrictions from variable types of lockdown have often affected those same people. As I said previously, Enable didn't plan for, or Eric said that Enable didn't plan for COVID, but the Enable cities, maybe by chance, showed very different reactions in types of lockdown and different severities of COVID-19, which were interesting to study and which we'll discuss during the day. There were also different reactions of different segments of the population. And we'll look at creative ways that green spaces or even open spaces were used in the pandemic. You can see from this graph, which is a summary of the very early mobility statistics for the cities or regions in our project, that the effect on mobility and different kinds of access in aggregate was quite different. So the case studies we'll be looking at today will provide quite a range of experiences. There are some very creative and important lessons to be learned in how cities and populations reacted to COVID. We'll hear examples of the use of brownfields in previously unused spaces, the opening up of cycle lanes in cities, the making it possible for all ages to use green spaces, even in very strict lockdowns, by regulating time slots, and also how populations, when seeking green spaces in times of stress, sought green views and tree cover and remote footpaths for social distancing, maybe even more than before or in normal times. So we hope in this meeting to raise the question and encourage cities to recognize the value of nature within their boundaries. COVID raises the importance of the value of nature even more than before. We want to see or connect in this meeting the need to plan for pandemics and mitigate climate change at the same time as we recognize the value of ecosystem services. And some of the questions that we'll raise during the day are, we need to plan for the long term, but what do we mean by the long term? Obviously, in the context of climate change and possible future pandemics, that long term is longer than it was previously. We need to be proactive in preparing for global change. Is there anything new that the pandemic, the perspective of refuges offers us? And we need to use alternative institutional arrangements. What would they be? We definitely need to start seeing managers of the city going beyond urban environment agencies to agencies managing social issues, and also to agencies for disaster preparedness, for example, and new connections between agencies at the municipal and regional and national level. So thank you very much, and I hope that introduction framed the presentations and discussion to come.
Thank you very much, David. That was certainly a very good introduction to the more in-depth topics that we're going to be looking at during the rest of the webinar. And we'll keep those ideas in mind as we zoom into specific cities and countries during the next hour and a half. I'd just like to remind you at this point that the Q&A box is open for your questions, and we'll be pausing for questions after the next speaker. So we go now across the Atlantic to New York. We are very happy to welcome Sarah Charlotte Powers, who is the Executive Director of the Natural Areas Conservancy in New York City. She draws on her background in land use planning, economics, and environmental management in her work. While working as a planner at Jonathan Rose Companies, she was the lead project manager for the creation of a new management entity for the South Bronx Greenway, where she focused on the creation of local revenue streams, including park-based job training programs, and the creation of markets for locally generated environmental services. For 7 years, she worked as the parks manager for Scenic Hudson, managing 15 parks. So she really has a lot of in-depth knowledge of green space management in cities on the ground. So over to you, Sarah, when you're ready.
Great, thank you. Let me just get my presentation started. Wonderful. Does that come through clearly?
Looks great, and we can hear you well.
Wonderful, great. Well, thank you so much for the opportunity to join the panel today. It's really a pleasure to hear from the other panelists, and I'm excited to have the opportunity to share a little bit of local perspective from New York City. I wanted to just start by giving a little bit of context about open space in New York City, and a very brief introduction to the organization that I work for, and then we'll pivot to talking about some research and findings specific to this COVID crisis moment, looking at both changes in visitation to parks and natural areas, as well as highlighting some of the unique challenges for nonprofit and government organizations working to manage parks during this time. But I'll start by just introducing, this is the island of Manhattan, the center of New York City. And I think one of the things for people who haven't spent a lot of time exploring parks and open space in New York City that is a little bit surprising is just how much parkland and specifically natural areas exist within the 5 boroughs. So the image here on our left is an image of Lower Manhattan, and this is a pretty iconic view of New York. It shows, you know, this is the area of Wall Street. It's the financial center of the city, and the sort of high-rise, high-density landscape is what people frequently think of when they think about New York. The image on the right is Inwood Hill Park in northern Manhattan. So this is the opposite tip of the island of Manhattan, and Inwood Hill Park has over 100 acres of old growth forests that were last cut over 150 years ago, and is refugio with incredible biodiversity and extensive hiking trails. Just going to take you on a very brief tour of some of the parks in the city where we do our work. And you can see it's a really incredible set of landscapes, really highlighting the historic natural diversity of our city. Just by way of a brief introduction of the Natural Areas Conservancy where I work, we are a nonprofit organization, and we work closely as a partner to the City of New York, expanding the capacity of the public sector to manage the restoration and care of 20,000 acres of natural habitat within the city boundary. And we're modeled on a institutional structure that's pretty common in New York City, and I think less common in other parts of the world, where through a formal public-private collaboration, organizations that are governed and paid for independently from public funds contribute in a long-term way to the care and upkeep of public parks. And before COVID, we were very focused on understanding at a citywide scale, both the condition and user experience of parks and natural areas. And I'll share two highlights from studies that were conducted in 2013 and 2014, and then we'll talk about how that baseline understanding has really helped us to shape our understanding of changes in user perceptions and user experiences during COVID. So in 2014, we completed, in partnership with the U.S. Forest Service, a assessment looking at user behaviors and perceptions of natural areas in more than 40 parks across the city. And I'll just highlight on this slide the last piece of text, which is that 50% of New Yorkers during this study, and this is thousands of interviews and observations, reported that they recreated exclusively in New York City parks. And people also shared that their primary or only access to the natural world existed on city parkland. Paired with that, we conducted, as I mentioned, a huge biophysical study looking at the condition of forest areas. And we found not only are people really heavily dependent on city parkland for access to nature, but nature within the city is much healthier and much more similar to rural forest and wetland conditions than was previously believed. Historically, we've worked really to weave together these social and ecological pieces of scientific information to create things like the Forest Management Framework for New York City, which is a 25-year roadmap that sets both biological and social indicators for the management of natural habitats within our city. And just sort of pivoting to COVID and kind of how our approach and baseline understanding has come into play. COVID hit New York City really hard. We are an incredibly dense city, and the majority of people do not have access to privately owned open space. So most people live in apartments, and frequently in high density, high rise apartments. And our cases spiked very quickly, really early relative to the rest of the US. From March through October, we saw a real sea change in both the use of parks, but also in the sort of funding and press and research related to park use. So as I mentioned, and I'll share some press clips on the next slide, we saw a huge increase in reporting both locally and nationally about the importance of parks and open space as a safe place where people could spend time outdoors. And even during the periods of most restrictive lockdown in New York, while playgrounds and sort of sport facilities closed, our larger parks and our natural areas remained open. We've also seen a real proliferation of research looking at use of natural areas and just that sort of perceptions and the importance of green space generally. And then paired with that, we've seen huge decreases in public funding and investment and staffing. So we're kind of feeling this pinch of an increased reliance on parks while we are simultaneously experiencing a disinvestment in parks. And I'll talk about that in a moment. And then I'll say already we are seeing really real implications in terms of decline in the condition of maintenance. And we also had a large storm that came through about 2 months ago, and we saw a lot of challenges with basic storm response and tree removal due to decreased staffing. So here's just a couple of press headlines from April of this year, and you'll see really highlighting both locally and nationally the importance of parks and open space as a safe place where people could spend time outdoors. We've seen a huge increase in visitation during this time period, and a couple of stats that I wanted to share. We conducted this summer a social assessment where we interviewed park users in natural areas and parks across the city. 65% of the people we interviewed reported that they were spending more time in natural areas than prior to COVID. And they cited things like needing space for social distancing, needing a respite from the stresses of life during both a pandemic and a recession as the primary reasons they were spending more time in natural spaces. We've also seen a huge increase in volunteerism in our local park system. And this photo is my 3-year-old on a work day at our neighborhood park. We've also conducted or contributed to a couple of research efforts that have really shaped our understanding. So this is a screen share from a report that's on our website, naturalareasnyc.org, where we surveyed the nonprofit community that assists in the management of natural areas. So these are organizations that are privately funded, but whose mandate includes either forest or wetland restoration and management. Almost 60% of conservancies reported decreases in staff during this time. Over 75% reported an increased reliance on volunteerism to conduct basic natural area restoration work. And this last stat, which I think is really important, almost 40% reported that natural area staff had been pulled from working in the care of natural areas and into performing basic maintenance and operations functions, including litter removal, in order to compensate for overall staff cuts. This is a screen grab also available on our website from a national survey that we conducted. At the end of this summer, we run a national network of teams from 12 US cities. And this is really our effort to baseline an understanding of the kind of immediate impacts of COVID on cities across the country, both the public and nonprofit sector in doing their work. And again, similar findings to what we saw in New York, a real increase in visitation to parks during this time period, as well as significant impacts on both staffing and budget during this time. So as we sort of move into the fall and into the next year, there's a lot of conversation about new ways to monetize and communicate about the benefits of natural areas. So this is the third study that I wanted to mention. This is something that we released in September, and it's a report that looks at the capacity of natural forest areas within New York City to store and sequester carbon. And it's the first time that we're doing this sort of independently of street trees and the larger forest, but really honing in on the carbon value of natural spaces. And we're looking at, and others are looking at, things like carbon credits and innovative financing as ways to begin to offset some of the financial hardship that we're experiencing as we look for ways to continue to manage our park space. So I'll zip through these last two slides. I'll just mention, we're looking, these are some challenges, decrease in public funding, hiring freeze, layoffs. The social landscape has been very tense. There's been a lot of focus on environmental injustice and economic inequality as the impacts of the recession have hit New York, as well as COVID has hit New York in a really uneven way that exacerbates existing inequality. And then at the same time, there's a lot of optimism about the potential for relief and recovery from COVID being a source of funding that can also include investment in parks and green space and climate resilience. So there's been a real coming together or an advocacy kind of around these three topics listed, and a lot of, I think a lot of new sort of coalitions and sharing that I find personally to be a source of a lot of optimism. I'll just share, this is my website and our and our web address if you're interested in looking at the full reports that I mentioned, or if you have any questions, I'd be happy to respond by email. And with that, I'll say thank you.
Thank you very much, Sarah. That was a very interesting overview of the experiences of nature in New York City, both before the pandemic and during the pandemic, and then looking a bit ahead at how some of the challenges that were there already and that are becoming increasingly important now can start to be tackled.
Yeah, thanks.
So we're going to pause for some questions now. And if I understand correctly, Sarah, you're going to have to leave us a bit before the end of the webinar.
Yes, unfortunately I am.
Not a problem at all, but this is now your chance to ask Sarah your questions. So please go ahead and put them in the Q&A box. I have a quick one just to get us started. I was wondering what the relative importance of the big, large ecosystem type spaces in New York City are compared to maybe smaller neighborhood type spaces during the pandemic.
Yeah, so I think we've seen sort of two interesting trends during the pandemic that are on the surface seem almost contradictory, but I think kind of represent sort of a coherent narrative. So we've seen a real increase in pedestrian and bike traffic in streets and plazas, and we've also seen a really big increase in visitation to natural areas. So I think people are looking to spread out, especially here, as I mentioned, playgrounds and sports facilities were closed for several months, and so the kind of go-to places where people were used to spending time, especially with children, weren't available. And so there's been both a push, an advocacy push to increase open streets and bike and pedestrian spaces, as well as a real focus on how to increase access and care of hiking trails and natural areas. So I guess we're sort of seeing people kind of break out of traditional park usage, both into the built environment and into more natural spaces at the same time.
That's very interesting. And we have a question here from Nazir that is slightly linked to that. They say that during the period when cases were increasing exponentially, open spaces were turned into field hospitals to support health services as part of the adaptation measures to the state of the pandemic at that point. What's your opinion of the approach?
Yeah, that was, so there were two field hospitals constructed in New York, one in Central Park and one in a park in Queens. And the actual footprint of those facilities was pretty small, but I'd say the sort of psychology of using park space for a non-recreation, non-parks purpose was pretty profound. I think both the idea of parks as a form of public commons that could be utilized for, health and human services, and also, concerns about safety and wellness definitely came up as issues. In actuality, those facilities saw very few cases. There was a lot of concern that there would be overcrowding at hospitals due to COVID, but I think something that people didn't account for was the decrease in elective surgeries and non-COVID related visits to hospitals during that time. So both of those facilities were open for a shorter period than they had been planned to be in service, and saw fewer patients than had been projected. So it was, I think, more a test of kind of our psychology around parks in the end than it was a long-term kind of change in use of park space.
Very interesting. There's another question here from Peter Wibborn in Stockholm. He says that it seems that many park areas in New York have characteristics of natural areas with rich biodiversity, rather than being intensely managed parks. How does this affect people's use of these areas? And do you actively steer people towards certain areas to leave other areas for biodiversity, or not?
Yeah, it's a good question, and I guess a couple of observations. So the city has park space that is under multiple ownership. So the city park system, which is managed by the City of New York, is 30,000 acres, and a third of that is natural areas. We also have a large national park in the Jamaica Bay region of New York City, which is down by the airport, if you've ever flown into New York City. And that is under it's under federal governance. In both cases, however, the natural areas receive just a tiny fraction of the overall budget for the park system. So in many ways, the work that we do during a non-COVID period is really trying to bring the level of investment and the care of those natural areas on par with the level of resources and investment that the quote unquote built park areas receive. Prior to COVID, the Parks Department has a staff of over 3,000 people, and there were less than 100 people assigned to work full-time in natural areas. So it's just like a drop in the bucket compared to the sort of staffing and investment. I think one of the things that we're seeing in this time is this really delicate balancing act of more people are using these places, which we think is great, but we're also seeing an increase of dumping, littering, homeless encampments, unauthorized or even dangerous uses, and there just isn't the workforce available to provide like a consistent level of care and patrolling and supervision. So depending on where in the city and the level of community involvement and sort of eyes and ears that exist in a volunteer capacity, we're seeing really different experiences when visitors go to visit these parks. And it's one of the things that really concerns us because you know, we feel strongly that public parks require public investment, and that's an important piece. But I guess to circle back to kind of the first piece of the question, yeah, the natural areas and visitation to them is promoted on the website, and there's ample information available about where these locations exist and how to access them and trails, etc.
Yeah, that's very interesting. And I could imagine that would be especially important in the context that you mentioned earlier, where 50% of New Yorkers get their only natural access in these spaces.
Right, that's right.
Mm.
Yeah.
So just to come back to a point that you just mentioned at the end there that links to the second part of Peter's question. You said that the parks are under different ownership, and he would like to know who is responsible for funding the management of these parks. Is it solely the city administration?
Yeah, that's a great question. So the management of public parks is primarily the responsibility of the public sector. But as I mentioned, the sort of nonprofit conservancy movement does raise a significant amount of private funds each year. So I believe the number I read most recently was that somewhere between 7 and 10% of all spending that takes place on city parkland, it comes from private sources. And usually that comes in the form of supplemental programming, concerts, sort of additional or extra amenities and resources for park visitors. But there's definitely some questions about kind of equity and fairness baked into this system, because larger parks and parks that have wealthier neighbors receive more private funding. And so it's kind of a perennial question for government about whether to equitably distribute across the city or whether to, you know, sort of skew towards investing in areas that receive less private dollars. And I think we'll see that conversation continue to unfold during this time for sure.
Yeah, I think it's going to be a very live topic as we eventually come out of this situation. So we have a question now from Cecile Conandelite. Sorry for mispronouncing your name, most likely. He says, for any of the speakers, do you expect transformational change in green space design and management because of the current pandemic?
I can give a quick answer to that, and
yes,
then
go ahead.
Offer it. So I think one thing, this week is the 8th anniversary of Superstorm Sandy, which was in many ways the last really big shock that we experienced as a collective here in New York. And there's a lot of discussion about expanding definitions of resilience beyond thinking about just the physical resilience or coastal resilience, but thinking as well about social resilience. So certainly in this past 6 months, there's been at least a lot of discourse about building more resilient infrastructure and park infrastructure in particular, and having that mean things that are resilient to climate change, but also that can function with less ongoing care, so that things that are sturdy and sort of built to last, so that as we look at kind of dips in maintenance, we can continue to have places that look and feel really vibrant. So that sort of planning confluence is definitely kind of alive and well in local discussions here.
Yeah, that's great, and especially the timing following 8 years since Sandy, which was different but similar shock in some ways. I see Eric would like to come in here as well for this question. So go ahead, Eric.
Yes, just a brief comment to that. What we see now is an increased desire for multifunctionality. We see that a number of uses that previously found other places in the city for whatever they were interested in are now moving out into green spaces and trying to find a space for their activities there. And this may be something that will last, that people will see the outdoors as an alternative place for an increased number of activities. So we have always planned open, like public green spaces for being multifunctional, but just what functions they are to support, I think may change, and that might require more of a transformative take on how we design them, not least to make sure that they are resilient and durable. As Sarah said, increased use mean increased wear and tear, and this is something we need to take into account.
Definitely, that's great. Noticing the time, I think we will leave the questions here and move on to our next section. So Sarah, if we don't get a chance before you need to leave, thank you very much for being with us today. It was great to hear some perspectives from outside Europe and to hear the point of view of somebody working with green spaces in the city on the ground.
Thank you so much, and enjoy the rest of the presentations.
Thank you. So I will hand over to my colleague Chantal Van Ham at this point.
Good morning and good afternoon to you all. So as Kate said, I work together with her in the International Union for Conservation of Nature, and we're a partner in the Enable project. And we would like to now share with you a few presentations from the Enable research team, starting with David again, who will tell us a bit more about the green refuges during the COVID-19 lockdown in Oslo. Then we will follow with a presentation by Dagmar Hase, who is a professor in urban ecology and urban land use modeling at the Humboldt University in Berlin, Germany. And this will then be followed by a presentation by Francesque Barrault, who is an environmental scientist trained in landscape and urban planning at the Institute for Science and Environmental Technology of the Autonomous University of Barcelona. And then our fourth researcher in this series is Christopher Kennedy, Assistant Director of the Urban Systems Lab at the New School in New York. So the floor is yours, David.
Thank you very much. We'd like to present some research that was done in Oslo. Oslo is a city of about 700,000 inhabitants, surrounded by a large peri-urban forest and sitting on the Oslo fjord, with a quite large amount of green space within the city as well. We looked at, in a paper, let me see here. There we go. The work that I'm going to talk about is reported in a paper which was led by my colleague Sander Venter in collaboration with Vegard Gundersen, Helene Figari, and Megan Knoll. And we looked at the use of green space in and around Oslo using Strava data collected through the Strava app, a training sports app. The profile, looking now for a moment at the mobility data from Google again for Oslo, if you recall the one I showed earlier today, looks quite different since the lockdown which occurred in Oslo on March 12th. Whereas we saw generally at the global level a drop in park usage almost immediately after the March 12 lockdown, the increase in park usage was positive. And of course, it increased during the summer months, which is normal because of weather situation. But what we considered with this data was that maybe the net effect of COVID controlling for summer conditions was actually quite large. The study that we're reporting from looks at the 2 weeks or almost 3 weeks after the initial lockdown, in which there were school closures, of course, quarantining, working from home, and decreased mobility. This is also the time that there was the greatest spike in hospital admissions to intensive care. And it was the time of most uncertainty regarding the risks of COVID. And it was the time since then also the strictest lockdown measures. So as I mentioned previously, we thought that maybe we could leverage Strava app data to look at whether there was a net effect of the lockdown on recreation, even considering weather. This shows some of the Strava mobility data. There are a large number of Strava users in Oslo and in Norway, although it has to be said that these are very active users doing exercise. And what we did with this data was we compared or calibrated the Strava data against trail counters that we had data for in some strategic locations in peri-urban Oslo, to calibrate the representation of Strava, the representativity of Strava users to the total population. Having done that, we then used the Strava data to look at the geographical distribution of use during lockdown. You see here the Strava data showing both the pattern of use and the total use in the graph at the top before and after the March 12 lockdown. And in summary, using this spatial data and the calibrated data, we found that the use of green spaces was almost 3 times as much after the March 12 lockdown as a comparable period in the 3 years before the COVID pandemic, controlling for weather conditions, temperature, rain, sun. This worked out to, on average during this lockdown period, of 86,000 trips per day. And if we value these trips at a time value of 130 kroner per trip, which is quite low, it's the mean salary after tax in Oslo, then that works out to about 11 million kroner per day in value. And what's interesting to compare to Sarah's figures of financing needs for New York, which I quickly calculated to about 15 million or $1.5 million per year, or 15 million Norwegian kroner per year. So with these figures, only in Oslo, which is a much smaller city, you could almost justify an increase in budgets with this kind of thinking. What we were also able to do with the geographical resolution of the Strava data was to compare where people increased their usage compared to characteristics of the open spaces. And what we found was that the Oslo population sought green space. There was a correlation in both pedestrian and bike use with green views measured as NDVI, which is a measure of the chlorophyll on the ground. And we saw that both compared to previous preferences, but especially for pedestrian users, the preference for greenness was very increased in large or areas with very high green views, and that was also true for biking almost across the board. Strava users also sought green space specifically with high tree crown cover. That was the case before COVID, but the effects were more pronounced. If you look here at the comparison between the green baseline and the purple lockdown situation, what was a tendency, especially for pedestrian sports before the lockdown, was increased with mobility after the lockdown. The Oslo population also used the green spaces to socially distance. We looked at the preference for path networks, and what you see on the horizontal axis is the trail density. And compared to the before lockdown situation, the preference for less dense trail networks increased. So there was, we interpret this as an implicit preference for social distancing. And that is in many ways confirmed by also the preference for areas with less population density. Those two things are obviously correlated. And just to remind you that this is data across the whole gradient from the inner city to the peri-urban forest. Recently there was a very interesting paper published from the UK looking at also impacts of the lockdown, and I thought it would be interesting to compare the Oslo case to some of the values found in this UK study. They found or rather this is England, they found that the restrictions, the lockdown restrictions in England fell by, or resulted in a loss of only 2.7% recreation trips, because people compensated the loss of recreation by car by increasing foot trips. So the economic loss of the lockdown was actually rather limited. But if they looked at the counterfactual of what green spaces would have meant for recreation, and under the implicit imposition of a stricter lockdown rules, this would have led to the reduced welfare of green space by 1.14 billion pounds in the situation where the model predicted that trip increase by foot without allowing for car trips increased to compensate for the lack of possibility of recreating using cars. For less strict lockdown rules, the increase in economic value would be equal to 1.147 billion, and this was related to a 27.5 actual observed increase in foot and car trips to recreation areas under less strict lockdown rules that were similar to the situation in Oslo. And I just did a thought experiment of transferring these values from England to Oslo. Bear with me, but the relaxed England lockdown rules for this scenario were equivalent to 208 million Norwegian kroner per day for a population of 67 million, considering a 27% increase in green space recreation over an 83-day period. If we downscale these values to Norway and then to Oslo, which has about a 1% population of England, that results in a value of 2 million kroner per day, with a similar reaction to the lockdown as the UK. But as we saw from the Strava data, the actual increase in recreation use during a lockdown situation, which was similar to the less strict lockdown in the UK, was over almost a 300% increase, i.e. 10% higher than in England. So if we use the UK figures for valuation, we could conclude that the value of green spaces in Oslo was as much as 22 million kroner per day during the initial lockdown, i.e. double what I referred to earlier. So somewhere between 11 and 22 million kroner per day during the lockdown period was the marginal or the incremental value of green space, which is more than justifies the need for funding in New York, let alone in a small city like Oslo. So my conclusions are there are likely large health effects and economic values of recreation in Oslo during the lockdown. We need to consider this refuge value of urban open green space as part of funding for disaster preparedness, but also funding for urban planning of green spaces. We discovered by trying to leverage mobility data that there's a lack of systematic mobility data that we can use to study the value of green spaces. It's the data on green space use is far inferior to, for example, funding for environmental monitoring programs. There's a real issue in also being able to leverage mobile operators' data from mobile phone usage, given that they are now trying to commercialize the use of this data, even for public interest uses. And we need to, in general, invest in urban ecosystem accounting so that we can quantify access to use of and the health effects of green refuges in a time of crisis. So thank you very much.
Thanks, David, for sharing this interesting analysis and all the data that you brought together. Very insightful. So there is a question from Norun Yertager-Groch to you. She asks if you have any information about the socio-economic distribution of the Strava users.
I couldn't give you the explicit answer, but we can assume that they are the active part of the population. They are a wealthier part of the population, but in terms of age distribution, it's quite similar to the population at large in Oslo, with the exception of children and the very old. But this is definitely something we could look further into, but we do recognize in the study that the Strava data was interesting to give an indication, but what we really need is the data from mobile phone operators, of course. Expensive, and they are trying to make this into a commercial product, whereas we and other public interest users of the data would argue that this data should be supplied perhaps at own cost, not for commercial purposes.
Thank you. So we will now go to the next presentation, but in the meantime, I'd like to ask everyone to put questions in the Q&A box so that we can have a discussion about them afterwards. So now we'll pass on to Dagmar Hase. She will talk about the role of green spaces during the 2020 spring lockdown and afterwards in Berlin, Leipzig and Halle in Germany.
Yes, so I hope you can hear me and you can just see my screen as well. I hope
yes,
so.
We can see it. Thank you.
So thank you very much, and it's a real pleasure here for having so many listeners here in our webinar. It was somehow a little bit by chance that this pandemic hit the last phase of the Enable project. So, but it was it is a kind of a very important, and to a certain extent also for socio-ecological research, welcome test of what we can say, what we did so far, and maybe also where we have to focus on what and where to change. Insofar, yeah, I will give you some ideas about the role of green spaces during the 2020 spring lockdown or shutdown and afterwards, with examples from 3 German cities, Berlin, Leipzig, and Halle. I mean, it's I think needless to say that we are in the moment in the phase of re-entering the situation again, because there's an foreseen shutdown, or smarter, lighter shutdown for the entire November. So we will see, maybe we can already now make use of what we have seen. Well, these are some reflections from my side rather than pure research results, but definitely our research is running also in Berlin and in Leipzig, and I can give you at least some insights. Let me start with this here. This is a park in Leipzig in the early shutdown, and you can see that there is nobody. So this is an interesting picture which refers and is in agreement with the curves David showed before, and I will show you in a minute. So you see the playgrounds are locked. And this also shows somehow the shock these neighborhoods were in, and we saw a lot of walking traffic along the streets, but people quite a bit nervous and just checking the situation. And so far, it was just cold, and normally people are not outside in this period of the year. When you come to the end of this shutdown, so in beginning and middle of May, you see then, of course, nature looks different. People came back. This is also Leipzig here. Is you see a bit of more usual behavior re-entered. People were very brave. And here comes a first interesting point into play. I mean, there is a lot of controversial discussion about the question of density of green spaces and of cities, and green spaces in cities and population density, whether this was a contributing factor for more infections and for more heavy way of this COVID-19 pandemic or not. This is very controversial, and I think there is no final answer yet. But what I can say here, look at Leipzig. This is very typical for entire Eastern Germany and for some other parts of the eastern part of Europe, where a lot of people left and the population densities are generally lower. And I mean, we never reached high fillings in the parks, even during the pandemic. And when I compare this to Berlin, where we had before the pandemic parks that are very, very full, take the in German Mauer Park or the Wall Park in English. So there were a lot of local residents who never went to this park because of this crowdedness. And this was the pandemic declined the crowdedness. So it was for the first time, and these are fresh empirical results from a survey we did. So local residents from Berlin took the opportunity to visit their closest park, this Wall Park, for the first time in their life in Berlin, because there were no tourists, and this general, a bit more hesitating behavior occurred. This dramatically changed now. Well, just in some numbers, you see here, these are these Google data, the parks, people have been returning to parks across the world. So Germany is no exception. You see what David already showed. So in the early phase, there were just a lot of uncertainty and people simply did not go out, but this changed dramatically in the run of this shutdown, and of course also afterwards. When you then go a little bit into the, I would say, into the justice question, so who is able to access the parks, there's a wonderful number of curves here from UK. UK is always a bit of the front runner when it's about these European injustice issues, sometimes I feel. So you see the higher the richness, so that means the lower the deprivation, the more space or average size of private outdoor space is available. You see this across a lot of UK cities. And now I show you some examples from Leipzig. This is a paper by which I co-authored together with my wonderful colleagues Nadia and Anne. Maybe they are in our virtual audience now. And what you see here is this is the city of Leipzig. And look at this dark gray color. This is the only thing you have to look at. This is the reurbanization where more affluent households, younger households, competitive households, you can say, so move into the city, this cluster. And you see, when I now overlay the most attractive, biggest recreation area, the floodplain area here, you can see in this green area, the darker color beyond gets even more. So we have a very typical issue, not only in UK, but also in German cities, that the richer, the more affluent are closer to the most attractive and the biggest green spaces. And we have, of course, also nice numbers that prove that. Insofar, this is the setting where when the pandemic entered this socio-ecological system, you can say so. Some more reflections. Berlin and other cities were quite innovative to improve accessibility, because they are very aware of the situation I showed you before, that not everybody has the same access and the fair access to these green spaces. So there were pop-up bike lanes invented in Berlin, where, as you see, almost no car traffic. Even more innovative, Dresden was with a pop-up bike bridge. Normally you can't go here by bicycle. So you see, from one moment to the other, a lot of things are possible. It's a pity to say that in Berlin, but also in other cities, they took back some of these decisions already during trials, because, well, the pandemic seemed over. Another important reflection is, where we didn't see any change was the allotment gardens. Here, an example from Leipzig. There are a lot of still elderly households that own such allotment garden or rent it. And they followed their normal behavior, they normally do, going from spring onwards to the allotment garden, having no problem with distancing here, having their own space, just can talk over the fence to neighbors. And so I would say this is one of the safest places for the most vulnerable group, these allotments. But as you see here in Berlin-Pankow, these places, these safe places, are under real pressure to get built, because the investment and the rent of the soil is very, very high. And we see this overall in Germany. Still, allotment gardens are nicely spread across the cities, because they were growing with the history of the city. But we are losing more and more of them, and there is no real lobby to preserve them. And we have seen how important they can be. Not for everybody, but for the particularly vulnerable. So my key message one would be here. The COVID-19 pandemic is highlighting cities' unequal access to green space in terms of both physical availability and accessibility, but also, and this I didn't show, in terms of occupational freedom and capacity, because there were a lot of people who could not use these spaces because they were needed elsewhere. What was also interesting, and when you just refer to these party situations we had in the green spaces in Berlin in particular, but also in other cities in the late summer, which contributed now to the coming back of the pandemic partly. I think during this shutdown in spring and after, green spaces developed into a real mirror of state and sensitivities of the urban societies, of fears, of distancing, of kind of non-acknowledging fear of others, of party making, reckless people, whatever. So this was very interesting that somehow what is inside were transferred to green spaces, an interesting societal mirror. Maybe we can talk about this a bit later. It's just a personal reflection from my side. But as I'm an urban ecologist, I want to use the opportunity to not only to refer to the social side of the social ecological system, but also ecological. And I mean, I put you here the H1N1 influenza A virus that caused the Spanish flu. And this was not a tropical one. This was not the first appearing in Asia or wherever. It was a situation like here. So we had a jump over of a virus from, you can say, water birds. It was in the US, or it is assumed to occur in the US, but it was setting like here in the Leipzig-Wahre-Setkin Park, where we have a little bit of wildlife, we have domesticated species, and people, as you see here in the background, very close. What I wanted to say with this slide here from Halle is maybe we have to rethink our cohabitation, humans and animals, wild animals in our cities that are expanding, and the space for wilderness is decreasing even in our areas. And Halle, I think the third city made a very interesting attempt. You see here this Raven Island in the south of the Saale floodplains. That this is again the central green area. And this was after 1990 completely got restricted for use. So it was just for nature conservation, no access for people. And it was in GDR times, in socialist times, a very famous recreation area. And all the recreation was transferred or concentrated in this northern part of the floodplains, where there's a lot of recreation, attractive recreation space. Maybe, just as an hypothesis, an opportunity to allow for both cohabiting, which might prevent such jump overs. And so far, my second key message from an ecologist perspective is humans and wildlife require real niches in urban systems where wildlife can develop without any disturbance while being surrounded by buffer zones where access by humans and livestock is limited, also by domesticated animals. Refraining from current increases in living space per urban capita, we must understand that this is the niche area for wildlife in and around cities that needs to increase first. Resulting from that, and having understood that co-evolution does not always mean cohabitation, rather partly parallel and partly integrated, we will be able to create healthy and resilient cities. And this is a really very, very serious reflection I made during this pandemic. Finally, I think after the pandemic is before pandemic. We need improvement of green space availability, accessibility, fair access at neighborhood scale now. We can not only refer to central green spaces, we need a better spread, but also allow for distance between wild animals and people. We need spaces for urban wilderness now and keep them untouched. A real challenge, but I think also something we need to think about in European cities, not only in maker cities, I would say. This was all my reflections from this pandemic and the social ecological system. Thank you very much.
Thank you very much, Dagmar, for these reflections, which I think are very valuable, also making that connection between health and biodiversity. And yeah, it's something that we have, of course, taken on board in the research from Enable, but the recent developments have made us, of course, reflect on this in many different ways. And at this moment, I don't see any questions for you, but I would encourage everyone to leave questions in the Q&A box so that we can address them later on. So then I'd like to give the floor to Francesc Baró, who will tell us a bit more about his research on nature and mental health during the COVID lockdown in Spain and Portugal.
Okay, thank you very much. I hope you can hear me and watch my screen.
Yes, it all works.
Okay, so thank you for the opportunity to present this recent research that we led together with the University of Porto in Portugal on the relationship between nature and mental health outcomes during the spring lockdown in these two countries, in Spain and Portugal. But first I would like to start with some inspiring pictures from my city, Barcelona, where there is this big public hospital that is called Hospital del Mar. So it's as the name indicates, it's located near the sea. And after the first outbreak, they start this program for recovering patients, COVID patients, basically consisting of taking them to the sea, to the seaside. And you can see some pictures that were actually in many world media. And actually, the patients here you can see in the pictures where he was in intensive care units for more than 1 month. So this was a very interesting program that started after the first outbreak in this hospital, and probably in other hospitals maybe they took the same initiatives. So basically, regarding the aims of the research. We know that there is scientific evidence on the beneficial health impacts of exposure to nature, especially during stressful life events like this pandemic. And specifically, our research wanted to evaluate if changes in the exposure to nature during the COVID-19 lockdown were associated with mental health outcomes in these 2 countries, and test whether these associations differed according to the country, since Portugal and Spain experience quite different restrictions in relation to access to green space. So basically in Spain, the first outbreak implied about 300,000 cases almost, and almost through 30,000 related deaths. And this was data from 3rd July 2020. And the government, the public authorities enforced a hard lockdown, meaning that visits to natural green spaces were forbidden, actually until 2nd May. And in contrast, in Portugal, the impact of the pandemic was a bit lower, also considering the total population. There was enforced a softer lockdown, where short visits to green space and natural areas were allowed, actually nearby home. So basically, we spread an online questionnaire to answer this research question or these objectives. It was a questionnaire with 25 items, and it was distributed during the lockdown between late March and early May. Basically, all residents above 18 years old residing in Portugal or Spain during the lockdown could answer the questionnaire. And we finally got about 3,000 participants, more or less equally from both countries. So 1,600 from Portugal and 500 from Spain. We basically circulated the questionnaire through social media platforms. So obviously we got some bias sample due to self-selection effects, and of course the results are not representative from the overall populations of these countries. So basically, what we tried to do with the online questionnaire was to cover the frequency, to see what was the frequency of visits, views, or care of different types of natural elements and environments before and during the lockdown. And we were very specific in relation to private green space and greenery, where we consider, for example, even indoor plants, balcony plants, home gardens, or even communal private green spaces. And this is due because, as I mentioned before, in Spain, in principle, the main nature exposure during the lockdown was only through private green space. In terms of to assess mental health outcomes, we use validated questionnaires measuring self-reported stress levels, psychological distress, and somatization symptoms. You can see here the main symptoms that we assess in the questionnaire. And just to show you a bit the results of this research, here you can see the proportion of participants in both countries who increased or maintained exposure to nature during the lockdown in both countries. As you can see, the proportion is very high for the majority of the green space types or green element types, except for natural spaces and for public green spaces. And this is, in Spain, obviously, this is due to the explicit ban to visit these spaces during the lockdown. And in Portugal, probably this was relatively, the low proportion was due to the fear of people of going out during the peak of the outbreak. So this is kind of the main results regarding the association between nature exposure and mental health outcomes during the COVID lockdown in both countries. Basically, what we found is that the most significant associations in Portugal show that individuals who maintain or increase visits to public natural green spaces or views of nature from their homes had less stress, somatization, and psychological distress. So for all the health outputs or outcomes that we assess. And in the case of Spain, the results show that those individuals who maintain or increase the care or the visits of indoor plants and community private gardens during the lockdown had also less stress and somatization symptoms. And just for some key take-home message from this research, the first one is that exposure to nature can be a relevant mental health coping strategy during the COVID lockdown. In Portugal, we saw that the prominent role of public natural green space or green spaces thanks to these softer measures in terms of lockdown. And in Spain, there was a kind of prominent role of private green spaces like indoor plants and community private green spaces due to the harder lockdown. This has, of course, some justice implications. Residents living in disadvantaged neighborhoods, like with poor housing conditions, limited access to green space, probably suffer more mental health problems during the lockdown, especially in the case of Spain. And the last message is obviously for decision makers and public authorities that should facilitate or at least not ban and organize always safely and with control access to public natural or green spaces during the current second outbreak of the COVID-19 or during future pandemics, and especially for those who with low or no access to private green space and greenery. So thank you very much for your attention. These are my contact details, and all this research is hopefully being published soon through this paper.
Thanks a lot, Francesc, and it's really interesting to see the comparison between the countries, and also, yeah, to have such timely information on how this situation is affecting people's lives and perceptions while we're actually still, yeah, in the middle of these crisis situation. I don't see any questions at this moment, but yeah, I hope we can have some more discussion on this important topic after our next speaker. So that is Chris Kennedy from the New School in New York, which is one of the affiliated partners of the Enable project.
All right, hi everyone. Thank you so much for having me. Hopefully you can see my screen okay.
Yes.
Great, thanks so much, Chantal. So I'm Chris Kennedy. I'm the Assistant Director here at the Urban Systems Lab at the New School for a research and design practice space dedicated to really exploring the idea of sustainable and resilient cities. And we take a systems approach to everything we do here. And what I'd like to do today is just share with you a little bit of the research we've been doing over the last few months, focused on COVID-19's impact on New York City in particular, and looking at urban green space access, specifically perception and use of urban green spaces, urban parks, open spaces here in New York during the crisis since the early spring of 2020. This is a project that has several partners involved, so I just want to quickly recognize. We're working in collaboration with the Building Healthy Communities program, the New York State Health Foundation, and the Nature Conservancy. And so they've been a really excellent network to really participate with in understanding some of the nuances of how urban park access has changed since April. Now, I just want to give you a little context of how we sort of started some of our research analysis here. You know, I lived here in New York City at the time, and I think it's a little hard to understand unless you've been here, but it was very much hit hard as Sarah mentioned earlier in the presentation today, by the COVID-19 crisis. I live a few blocks from a hospital, and so every 20 minutes you would hear a siren. The streets were quite barren, and it was quite a dreadful time. Since then, it has recovered a little bit, but there's still a looming kind of presence of the health and economic impacts of the crisis. And so early on, some of the members of our lab got together and we thought, what could we do to help? And we started to look specifically at a couple of key questions, right? Who would be impacted most by COVID-19? What are some of the drivers of social vulnerability? And so we used a social, ecological, technological systems approach to really start looking at some of the data related to the health crisis and also access to urban green space. As we started to look at the CDC social vulnerability indicators, we chose 15 of them to really use here, specifically in New York City, to get a better understanding of who is being impacted, what communities, what social demographic groups, and where. And so some of our key findings, very initial analysis that we did back in April, showed a couple of alarming trends, right? That might not be so surprising, but nonetheless are important to recognize here. Number one, that folks that are below the poverty line or that are low income were impacted disproportionately. Communities of color, specifically Latinx and African American communities, were actually impacted the most here in New York City, and very much disproportionately. Access to healthcare and insurance played a key role, right? Especially when we're looking at the severity, the death rates, and the case loads across the 5 boroughs. And also not just the population density of the city itself, but the housing density, right? There were a lot of multi-unit dwellings, very dense apartment buildings where folks are clustered close together, and that played a key role. From this analysis, what we were able to do is really get a sense of the spatial distribution of what was happening on the ground in terms of caseload, severity, and death rates across the city. And we identified a few key neighborhoods that we focus our attention towards, right? Notably the South Bronx, parts of Western Queens and North Queens, and South Brooklyn, which we'll bring back together as we start talking about urban green space access. Now, I think it's important to understand, and as Sarah said earlier in the presentation for the Natural Areas Conservancy, there are a lot of parks here in the city, but they're not all designed equally, right? So most New Yorkers are within about 10-minute walk to an urban green space, although a lot of these spaces are small pocket parks, they're plazas, they do not have benches, they do not have amenities that most folks desire, and so most of the larger parks are actually located in wealthier areas where there's mostly white populations, and communities living nearby these large parks that have recreational facilities and things that people want, right? So green space access is equal, but uneven, it's not equitable. And in our analysis, what we're trying to distinguish between is geographic access versus perceived access, right? So you might be close to a park, but your perception of access to that park might be hindered by some additional safety concerns that I'll talk about in the results of the study that we conducted. Now, in the late April, early May, many New Yorkers awoke to find signs like this, right? So as Sarah mentioned, all the playgrounds were closed, recreational facilities were closed, and some of the parks actually did have restricted access, right? So not all parks were actually open, including natural areas. Some of them were closed for several weeks. And still today, several green spaces do have restricted access. And so what we decided to do was to launch a social survey to really get a sense of what was happening, right? What is the impact on COVID-19 in terms of the perception and use of urban green spaces? Are folks going to parks more? Would these additional social distancing policies actually have an impact on the use and duration of how folks are using them? And so we were looking specifically at 4 key variables, right? The perception and use, the importance of mental and physical health, right? Has that increased since the pandemic? Also examining shifts in use, right? Some folks actually reported they reduced their usage as urban parks, not necessarily increased. And then understanding what are some of the desired features, right? What do folks actually need to feel safety when they go to a park or to actually get there and feel like they're having a good experience? So we launched our survey in mid-May, and we had it open to anyone living in New York City who was over the age of 18 for about a month. In total, we received about 1,300 responses, and about 1,100 of those responses were completed the survey sufficiently for our analysis. Now, it's important to know that we also launched a national survey, which we're still kind of analyzing with similar questions, slightly different, but we got about the similar response rate. In our study, we defined urban green spaces, right, urban parks and open spaces quite broadly. We wanted to try to incorporate as many different kinds of typologies as possible, right? So that includes large-scale urban parks or pocket parks, open spaces like plazas, NYCHA open spaces, New York City Housing Authority, natural areas, as well as community gardens, and kind of small little sidewalk areas. So some of the key findings from the survey that we launched, I'll share with you right now. We had 4 key findings. The number one thing that we found was that there is definitely a shift in use in urban green spaces based on the results of our survey. We weren't actually able to determine an increase in use, but rather a shift in use, right? So some folks actually decreasing their use over time, some folks reporting an increase. So over 40% of respondents said that they're visiting parks at least 3 to 4 times a week, if not once a day, and they're there for about 1 to 2 hours at a time, and about 15% are actually increasing their park use. Now, some of the common concerns that we saw in the reports of the survey were not surprising. The number one thing was folks not practicing social distancing, additional safety concerns, concerns over it being too crowded, and also police presence, not enough park staff, right? So these were kind of reported concerns that folks were saying, if this is happening in a park nearby me, I'm not necessarily going to visit it. The second key finding, what we found was that the importance of parks for urban green spaces for mental and physical health is quite high, right? So over 80 to 85% of respondents said that it's either extremely or very important to their mental and physical health during COVID-19. And this is actually slightly higher than the baseline, which we sort of asked, did that change from before the pandemic hit in April? Notably, mental health was actually rated much higher across some social demographic groups. So we're really looking at the kind of understanding of the nuances between physical and mental health here. But I think it's important to know that mental health was very much chosen as something that's incredibly important during the COVID-19 pandemic here in New York City. We also found that across social groups, right, whether it was Latinx or Black communities or white communities reporting through the survey, that they had different needs and different desires for parks in different areas of the city. And this actually affected their perceived access to these parks in many different ways. So just to give you a sense of some of the results that we're finding, that over 85% of respondents said that they actually require or they desired trees, places to sit, places to walk in the park in order for them to feel they have safe and easy access to that park or urban green space. I think it's important to know that the majority of parks in New York City don't have many of these features, right? They're just small little pocket parks. There might not necessarily be a lot of tree canopy or amenities that communities desired. And so really understanding the nuances and differences between different social demographic groups became a really key finding for us as we were beginning to analyze some of the data. And the last key finding that I'll share was that perceived access, right? So the sort of desire, the sort of willingness or ability to be able to go visit a park as opposed to it being just located next to you geographically was quite uneven across the 5 boroughs. So in our data, what we found was that in areas of Brooklyn and Queens, that they were reporting a lower perceived access, right? Despite there being quote unquote equal access to parks in those communities. And I think it's important to understand that once we start looking at social vulnerability indicators, the income levels are one sort of key variable that keep coming up again and again as affecting some of these different kind of results that we're getting. And what we're trying to do right now is look at some of the perceived versus geographic access sort of data and models and overlap that with COVID severity rates, right? So the clusters that we identified early on at the onset of the pandemic actually overlap in many ways with the sort of reported lack of perceived access in some of these communities, which happens to be low-income communities or communities of color, notably in South Brooklyn, parts of the Bronx, and Western Queens. And so as we're working with some of our partners, we're developing some recommendations that we hope to publish in either an executive summary or report that we would offer to city officials and to other parks managers. the first recommendation that we have started to discuss with folks at the Nature Conservancy in the city is the need for consistent and clear guidelines, right, that go across all different kind of urban green space typologies, and to really think about increasing the capacity and funding to ensure that we can manage other extreme events in the future, right? So just to give you a sense of, the diversity of guidelines and rules that New Yorkers are sort of wrestling with. You can see some images here on the screen, right? There's so many different ways that folks are describing how to use these spaces safely, whether they're open or restricted. And so a lot of the park officials that we're talking to really would love to have like one set of guidelines that we can apply to all these different spaces, and to really make it clear, when these things would be initiated and when parks and spaces would be actually reopened. Another important issue too is that extreme weather, climate issues can interact in a lot of different ways with the COVID-19 pandemic here in New York City. One example is a tropical storm that came here in late August, which caused a power outage in New York City for some people for several days, and it downed a lot of trees, right? So the high winds actually created a lot of damage across the city, and the New York City Parks Department is actually in charge of clearing those trees. Because of the furloughs, the reduction in staffing, they weren't able to actually get there quickly enough in order to restore power to many communities, right? So we're starting to look at what are the interdependent and interacting variables that might actually make the health crisis actually worse when we have to encounter extreme weather in the future. And so what we're looking now is kind of an understanding of multi-hazard risk, right? So how are these different kinds of variables interacting here and into the future? And the last recommendation that we have started to develop with some of our partners also is to really thinking about how do we reframe urban parks and open spaces as critical urban infrastructure, right? So not just think about them as essential services, but as something that the city can support in a more robust way long-term. And so we're looking at different ways of addressing some of the survey responses we got about travel times, about access to larger parks. And so what would it mean to actually develop green corridors, greenways that actually connect some of the pocket parks in small areas to these larger facilities and parks that folks actually want to visit? Can we use perceived access, right, as a tool to really get us a more equitable assessment of urban green space access during COVID? Right. So this is a research study that's kind of underway. You can check out some of the results on our website, and we're hoping to publish a few papers in the future. But I think I'll just end it there. And thank you so much for having me.
Thank you so much, Chris, for this detailed overview. I think it gives us a lot of food for thought, and it also shows that there's a lot of universal issues across our cities, whether it's in New York or here in Europe. So I was looking at the questions, and here's one from Roland Kremer. He says it's perhaps a bit provocative question to Dagmar, but also to all the presenters. So maybe you have some thoughts on this. How do you deal with the fact that the lockdown affected people extremely selectively, especially regarding employment and perhaps also childcare as a driving factor? So he says it means that people simply couldn't work because their workplace was locked, or because kids were at home, or they had other time options to go out. It was also good weather in March. So yeah, some people may be more disadvantaged to go into the green spaces or not. So do you have some thoughts on that?
So thanks, Roland, for this question. And I think I don't know exactly who is in the audience, but at least we as speakers, we were all somehow privileged, right? So that we could just go to home office. So we are very comparatively safe, and we got our salary. And so far, I speak from this position, and sometimes I really felt very, very sorry with people who couldn't, you couldn't follow the same way of a comparatively safe life. And I think what I said in my presentation is, and I think this was very often said in the press, but also by other people, by other scientists, and written in these nice stories of the TUNC, the Nature of the Cities, where we had a collection of experiences of scientists, private ones, but also some scientific reflections. And what they all said is, we have here COVID-19, or better to say this pandemic, is a very sharp focus for everything, for every kind of unfairness, injustice, difference. Doesn't need to be always bad, but just difference that we have in our society. And this became very clear. It came just on the desk. And I think this is, and this is also important when we talk about green spaces. All the people we saw there, all the activities or non-activities, all those who benefit, all those who couldn't go. This is just, I would say, a sample that is definitely biased, and maybe it's a new bias, an interesting one. And insofar, Roland, you are completely right. And I think this is just missing a bit in our surveys we did so far, because in Berlin, we also asked people within the parks, in the Wall Park, were you there during the pandemic? Are you here now? It is better. Is it better? Is it worse? It is too close. It is too crowded, blah, 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 right? But what we did not do is reaching people that live close by, but cannot go because of their occupational duties. And this is something, I think, this could be a nice task for a city which is responsible for the entire population and needs to know how different groups of people benefited or non-benefited from green spaces during this time. I think this could be an important task for a city to deal about these different groups. Maybe so far from my side.
Thanks, Dagmar. Yeah, so there are still a few questions here, but I would, looking at the time, like to move to one of our guest speakers who is with us here today, and that is Norun Gjerdager-Krogh, Senior Scientist of the Department of Environmental Health of the Norwegian Institute of Public Health, and she has kindly offered to share some of her views and perspectives on these topics. So Norun, please go ahead.
Thank you very much for this very interesting webinar, and also to have the opportunity to present. So I will first talk about a study that I'm conducting together with the Norwegian Institute for Nature Research, and I am at the Norwegian Institute of Public Health. And it's a survey about physical activity and mental well-being, as many others here have such a survey, and about the significance of green spaces near home. So, but this survey is conducted over the whole time from March and until September. So the backdrop for this survey is the varying conditions, the varying restrictions, and then to see to what extent parks and green areas near home help maintain both physical activity and to ease the mental burden, as other surveys have done, and to look at what is the relationship between perceived difficulties or discomfort in practicing social distancing outdoors. We should also do that. And activity level and mental recreational benefits from visiting green spaces. And then we will also look at what neighborhood green space characteristics are associated with less perceived difficulties in practicing social distancing outdoors and maintenance of physical activity and mental well-being during the pandemic. Yeah, and the data is from, it's a panel study, as I said. It's conducted in 6 waves from April to September. And it's a national representative sample. So it's both urban and rural areas in this sample. And the questions were included in the Norwegian part of an international study called COVID-19 Behavior and Context Survey. So it's mainly about how this disease spreads through your context, how you behave. But we managed to get into the questionnaire also these questions about the use of green space. So we asked about the general level of physical activity, if it was the same as before the pandemic or if it increased or decreased. Because in the beginning of March, when the fitness centers were closed, for instance, until June, but now they are open again, so there are varying conditions. And if they visited local green spaces more or less than before the pandemic, the reasons for visiting green spaces during the pandemic, and the difficulties or discomfort in practicing social distancing outdoors. And all these questions were asked or related to the last 3 weeks each time. And then we want to link this survey data to GIS data and to characterize the green spaces of the local areas of the respondents, because we have access to the postal codes. But now, I'm sorry I cannot show you any results yet because we are waiting for the ethical approval to link the data. So this will just be a taste of what we are planning to do. But hopefully I can show you results another time. Next slide, please. Yeah, and these are only the quite complex data structure. So it's the different waves and the dates. So it's a monthly survey. And although this is a panel study, new participants were also recruited in several of the waves. So it's not only the same participants, it's also some new ones. And we also have some dropout between each wave. So it started with 1,400 in the first wave in end of April. And now in end of August, it was 645 participants in the last wave. And I heard they got the last or the total data. They have just received that at the Institute, but I have to wait a bit more for the ethical approval. But I'm looking forward to analyze the data together with Nina. And we could also, I think it's very interesting to hear about the socioeconomic differences in other countries. In Oslo, it's a very what groups do actually use the green space. In Oslo, 98% of the inhabitants have a green space as close as 300 meters from their residence. But another question is, what is the quality of the green space? Is it safe? Do they use it? So yeah, so that's interesting. And I think one thing is the actual amount of green space, but maybe an important thing is also to educate people or to take them out, organize trips, learn them how to learn them the benefits in a way. Thank you.
Thank you very much, Norun, for sharing your insights here, which is also very interesting. So I still see a few questions here that we will try to address in the last moments that we have available in the webinar. So there's one here for Francesc from Sean Goodwin. He says, you said there were probably justice implications, and he asks what that means. Were there questions to test for this? And if so, which were they?
Yeah, thank you for the question. Actually, in the survey, we control for different socio-demographic and housing characteristics of the respondents. For example, educational attainment, income, housing typology, and things like that. So the problem is that we, as I mentioned during the presentation, we had a strong bias, let's say towards respondents with high educational attainment, for example. Probably we had self-selection effects, meaning that people who like green space or who like plants, having plants, were more prone to respond. And that's why we didn't, in the survey, we couldn't, let's say, directly interfere a relationship with justice aspects. But we know that, for example, in cities in Spain, like Barcelona, there is many people living in poor housing conditions without any type of private green space access. For example, people who doesn't have even a balcony with plants, or they don't have any community green space in their house. So these people during the lockdown were, I mean, they couldn't have any kind of access to green space. And that's why I was saying in the presentation that probably there were just some justice implications during the lockdown in Spain, at least.
Thanks for answering that. Are there any further reflections from the panel, from the speakers on previous questions or what they've heard from the other speakers that you would like to bring forward?
This is David in Oslo. So I have a question to my colleagues in the different cities and anyone in the audience who works in urban planning. Have you seen any change in the way municipal agencies interact due to COVID? We hypothesized at the beginning of the seminar that this would be an encouragement for more interagency collaboration. I learned from my colleagues in Oslo that they really were already working in this fashion, and that COVID only intensified a working pattern that they already had. But I'm wondering whether, so for example, the Agency for Disaster Preparedness Planning, Environment, Water and Sewage, they have a sort of disaster preparedness task force, which they then use for COVID-related issues. I wonder if is it similar in the other cities?
Who would like to answer that question?
Maybe I can say just one sentence, even if it's also provocative. And yeah, I had the feeling they disappeared at the beginning of the pandemic. So they were not reachable. So at least those we approached for several questions. This might be a typical German administrative gap or problem with also computational accessibility. But I have the feeling, and I know in the audience there are some other colleagues and friends from Germany, correct me if I'm wrong, but I had the feeling they were paralyzed, and I don't see any change at the moment for now. And insofar, it is wonderful to get to know this, David, from Oslo, that it was a positive push, maybe something like that. For Germany, I couldn't say that. So,
thanks, Dagmar. Chris, can you maybe say something about that for New York?
Sure. Yeah, New York City is it's a complicated city. There's a lot of bureaucracy here, but I think you are seeing some easement of restrictions, an embrace of outdoor culture, right? So outdoor eating, using parking spaces for dining is now permanent here in New York. There has been an open streets and cool streets program that's been established, right, to really open up some streets in areas of the city close to parks, and that has been announced to be continued for next year. But there's still a lot of debate about how to properly fund, right, especially the New York City Parks and other city agencies that help to manage open spaces, and a lot of debates around, current furloughs and staffing and things like that. So we're seeing a massive reduction in budgets and a lot of concerns amongst residents about what that means actually for access to natural areas and urban green spaces long term.
Thanks. And Francesca, is there something you want to add on this?
Yeah, in Barcelona, just maybe similar to New York, there has, let's say that the pandemic has triggered some quick transformations in the city, like for example, using tactical urbanism. I don't know if the people is aware of this this concept. So basically what Chris was saying, that trying to increase the number of bike lanes, for example, quite quickly using just painting the streets or enlarging the sidewalks. This has been quite relevant in Barcelona, and also especially also in close to schools, that they are kind of giving more space to people where they in the school hours. And in the same and similar to that, also parks and green spaces are being used more often by schools as a kind of additional schoolyards to avoid that all children are using the schoolyard at the same time, so they are using parks instead.
Thanks, Francesc. So I think with that, we have to go to the close of this session. I would like to thank all of you for your fantastic contributions, and also to all the participants for their active contribution and for staying with us throughout this session. We will make the PowerPoint available, as well as the recording, and we hope that we can also share it with others who haven't been able to join today. So then I'd like to hand over to Eric for the closing words.
Thank you, Chantal, and thank you everyone who has stayed with us now for 2 hours. And I guess part of the take-home message, as I started the presentation, or with my presentation earlier in this afternoon, the take-home message really is that this issue of access to green spaces and various opportunities to make use of them to fill different needs is a question not just about making sure that you have high quality available green and blue spaces, but you really need to take into account all these other things. We've heard about mobility, we have heard about different institutions, regulations, restrictions to use, or ways of opening up use or for different, for example, underprivileged groups. And we've also heard a lot about perceptions, and all these things need to come together. So to plan for more available, accessible green benefits, we need to think about all these different factors. Some of them are more long-term, to making sure that there is green and blue infrastructure available, but some are things we can change and work with more actively. The different institutions, the regulations, working with people's awareness, knowledge, perceptions of things. So there's a lot that can be done short and long term to better deal with the ongoing pandemic, and also to make sure that we emerge from it with green spaces that are more accessible to everyone. Thank you.
Thank you very much, Eric. So with that, we come to the ending of this webinar. Thank you very much again, and looking forward to continue this this dialogue and to stay connected on these important topics. Goodbye.
Thank you so much. Bye-bye.
Chantal and Kate, bye-bye.
Thank you. Bye.
Thanks for a great meeting.